Moving forward to session 4, improving healthcare and system and healthcare policy for wellness, creating environmentals for equity. This session will focus on the role of the healthcare system and public health policy in promoting health and reducing inequalities. The participants will discuss strategies and policies for promoting cooperations to create equalities in the healthcare system. Ladies and gentlemen, to moderate this session, please give a warm welcome to our moderator, Ms. Caitlin Richel Johnson. Caitlin, I will now hand off the stage to you.
Hello, Sawadika. Good afternoon, everybody. I'm Caitlin. I am a social studies teacher at Darun Sakalai School for Innovative Learning on the KMUTT campus. Thank you so much for having me today. It's an honor to moderate this panel. So first, I'd like to start by inviting our panelists up. Whoops. Our first speaker will be joining us over Zoom, Miss Andrea Chan, the head of Touch Mental Wellness and Touch Wellness Group in the Singapore Charity Organization. We'll also invite Associate Professor Dr. Tavida Kamovej, Deputy Governor of Bangkok, Thailand. Excellent. And our next speaker is Associate Professor Chanchai Sitapunt, the Dean of Faculty of Medicine at Chulalongkorn University. Oh, okay. Our next speaker will be Dr. S. Gunintira Rao, Public Health Medicine Specialist, Senior Principal Assistant Director at the Ministry of Health, Malaysia. Thank you. And lastly, we'd like to invite to the stage Associate Professor Dr. Wanrudi Isaranuwachai, Program Leader and Senior Researcher of the Health Intervention and Technology Assessment Program. Thank you. Can we have a round of applause for our panelists? Excellent. So as our host mentioned earlier, this session focuses on the role of healthcare systems and healthcare policy in promoting wellness and reducing disparities. We'll examine policies related to healthcare access, social determinants of health, health equity, and their impact on wellness outcomes. Strategies for advocating for inclusive policies and fostering intersectoral collaboration will also be explored. In this session, the 5 questions will be, how can public policy initiatives such as healthcare reform and social determinant of health interventions contribute to reducing wellness disparities? What are some successful examples of policies that have improved access to wellness resources and services for marginalized populations? How can intersectoral collaboration and partnerships between policymakers, healthcare providers, community organizations, and other stakeholders be fostered to address these wellness disparities? What are the potential barriers and challenges in implementing equitable public policies, and how can they be overcome? And the final question is how to effectively advocate for community participation to influence public policy decisions in the prioritization of wellness equity and social justice. Whew. That's a lot. Are you ready for this? Excellent. So our first speaker will be our friend over Zoom, Miss Andrea Chan.
Hi, good afternoon, everyone. Can you see my deck of slides? I hope all is good. Hi, a little about what Touch Community does before we go into how we have been part of the whole public health policy in Singapore. So, Touch Community Services, we are 32 years old this year, and our mandate really is strong families, caring generations, and able communities. At the end of the day, while we might be a charity, our dream is that we work ourselves out of a job, that nobody will need our services anymore. So that really is our dream. So we have a lot of different services, 23 services, and today I'm sharing with you from the mental health service. And this is part of the wellness group. So in Singapore, this is confidential until September. We just launched it in September, October last year. And this essentially it's our policy on how we will right-side mental health services in Singapore. And we have 4 tiers if you were to look at it. So in tier 1, essentially are programs that are for health promotion. So wellness, mental wellness promotion, education pieces of work. In tier 2, it's when we do screening and we say, hey, they might need basic emotional support. For example, students who are going to have their exam soon, or you are working towards a promotion and now it's your performance appraisal season. So you might be feeling a little bit of stress, but it's temporary. So that will be tier 2. In tier 3 are those whose functioning has been impaired. For example, if you might have depression, if you might have anxiety disorder, but you may or may not be diagnosed at this time. And tier 4 is when you need psychiatric help and you are in a tertiary hospital getting psychiatric help. So this is for hospital care needed. So this is how Singapore actually manage our mental health services as of last year, 2023. So in touch, how we have done it is we started our journey very much like the tiered care model. We started doing Light of Hope, which is just advocacy for mental health. And as you can see, over the years, we have increased in our intervention pieces of work to now we cover tier 1 all the way to tier 4 piece. And so this is how we map our programs and the emphasis in the various tiers. But the focus that I have today with you, it's on Beyond the Label, which is a national mental health campaign, which is not just done by Touch alone, but it's a collective of 27 agencies as well as government bodies coming together to say, let's do some promotion on mental health. So in our national strategy, we want to expand capacity in first stop touch points in primary care and community. We want to increase the capability of our service providers, and then health promotion should be on the label, and as well as improve workplace health care, mental health and well-being. So one of the first things we did when we have this policy was that we say that for fair employment, you need not declare your mental health condition when going for a job interview. So we are influencing policies on a national level to help to be more inclusive. So for Beyond the Label, what is it about? It started in 2017, really with the aim to fight stigma. When people come in and say they have depression or anxiety, in the past, we used to think that they are crazy and we stay away from them. But we want people to know, we want Singaporeans to know that that is not true and that they can have a chance at recovery and we can be that supportive force. So in 218, these are some of the things we have done. We have the formation of Youth Alliance targeting on youth mental health. We have a FAIRS. We launched Bell Chatbot. So Bell Chatbot has gone, it's like a chatbot where people can get help and know where is the nearest service to get help. We launch videos. We are part of Singapore Kindness Movement. So we have done a lot in terms of influencing mental health and breaking barriers. And so these are some of the pictures, some of the fairs. So during COVID, we couldn't have a physical fairs. So we had a virtual concert. We had conversational cards. How do you have conversations with persons with mental health? Because in Singapore, we are aware of mental health conditions, but we are not so much aware. How do we reach out to these people? How do I have conversations? How do I know if I'm not saying the wrong thing? So we have conversation cards and escape room, trying to engage the youth through a fun way to learn about mental health conditions. And now we are embarking on Beyond the Label 2.0. And what are some of the things that we are doing? We are taking action to be more inclusive, meaning we have gone from online Beyond the Label campaign to on-site in the community, which I'll show you in a bit, and social inclusion. So we have actually changed Beyond the Label. In the past, there was only one track, which is campaign track. And then we have our hybrid activities, we have our annual event. But now we have gone to the communities, meaning in the workplace. We are in there and we are influencing policies, HR policies. Our Ministry of Manpower is on board on some of these HR employment policies as well. We are with families, our Ministry of Social and Family Development. They are also part of this group where they are looking at parental resource. How can we help parents better support their children? How can we help caregivers? Because as you mentioned, there is great caregiving needs and it takes a toll on the caregiver. So how can a caregiver take care of their own mental well-being? And then we are with MOE and MOE Ministry of Education, as well as all the tertiaries are also part of this piece where they talk about when we do resilience tool, we do training, we do roadshows to promote mental well-being. And then we are also in communities, in neighborhood, in towns, where we do residence training, how to be a good Samaritan, how do you take care of neighbors who might have mental health conditions. So we have our annual fest. This is our annual fest 2023. We are going to launch our next fest in 2024. And these are the road shows that we do, not just in schools, but we also do it in hawker centers. We do it in community centers where we are at as well. And then we have pebble painting, people painting their support for persons with mental health conditions on a pebble, and we install it in the towns that we serve. For example, there are towns in Queenstown has a pebble walk where they can see all these messages of support for persons with mental health conditions. And this essentially is how we have tried to make mental well-being inclusive and policies to be inclusive regardless of ages, regardless of conditions, and also regardless of where you stay and your social economic status. And with this, I end my presentation. Thank you so much.
Excellent. Thank you so much for sharing about your wonderful work. Please stay with us until the end if we have time for a Q&A. All right, and next I will invite Dr. Tavita to speak.
Thank you very much, and thank you for inviting me here. This is my first time here. So as we talk at the leisure time, that this is like first time that we are here. So I have 10 minutes, and of course, I'm from Bangkok Metropolitan Administration. So since you seem to have Ajahn Chanchai in your list, the Dean of Faculty of Medicine, Chulalongkorn University, I just met him yesterday. We had like 2 hours talk, so I'm going to talk on behalf of him. So that it's a networking between Bangkok Metropolitan and also the UHOSNet. Right now, we are working as a network of public health and public health care. So I'm going to brag about it in a little bit. Let me drag you guys into a policy of Bangkok itself first. In Bangkok right now, we seem to approach not only the healthy city, we are trying to get into a resilient city as well. So right now, we are changing the conceptualization of just focusing each of the dimension alone, because fragmentation and siloism is actually one of the classic problems dealing with public sector. So as of that point, when we talk public health or wellness, we seem to define public health and wellness together with safety, together with resilience, together with environment, and also climate change, global warming, global boiling, and everything that actually going on right now. And as you can see, we also grab structural and non-structural measures all together. We are talking city design. We are talking research base. We are talking emergency. We are talking prevention, preparedness. In all of this, we actually emphasizing on 9-dimensional development. And this 9-dimensional development is actually underlying that. Each of the black bowl is actually each of the dimensions, which include, of course, healthy and medical kind of service, as well as safe and vibrant community. These, number 5 and number 8, altogether is actually the fundamental of being resilient. Anyway, if you look at the green line, it's actually trying to tell you the sub-dimension of each of the field that we actually try to focus on. And we're running by OKR. And we actually trying to do good health, good society, and good safety altogether. And our focus is not at the advancement of super tertiary, much like UHOSNet, Chulalongkorn University, Washira Hospital, and also Rama Sirirat, as of we know of. No, not only that. After COVID, one of the things that we realized that it's to waken the society up. Bangkokian is not pretty much like any other in 76 provinces. We don't trust primary care. That's for a huge while. Even today, I don't think that come back 100%. We don't trust healthcare in the primary center. And because the logistic is too convenient, so we are just storm into the hospital, making a queue in the public hospital pretty much late. You go there before 5 in the morning and you get a queue at noon. And the doctor actually see you for 3 minutes. So by far, we don't want that to happen anymore. So we're focusing raising up and upscaling the primary care. However, let me throw you the number. We have 5.49 million registered as a Bangkokian. Do the math. We have another 2.2 from other provinces staying overnight, earning their living, making a career part. That go to 7.7 million. And every morning we have people commuting from vicinity around Bangkok, another 2 million. So you ended up 10 millions a day. Are you really going to make public health care and public health center working alone? My answer would be within Bangkok, no way. Impossible dream. You can dream over the dream and over the dream. It will not be true because we have about 137 to 140 hospitals in Bangkok. Only 12 belong to me. I'm sorry. Only 3 belong to Ministry of Public Health. Only 4 belong to police, army, navy, kind of like Air Force. And only other 3 belong to Chulalongkorn University and Mahidol University. You are talking only rounded up 20 out of the 140 is actually public. Who can afford that? The 10 million, among the 10 million, only 1/3 and can actually access a private hospital. So, okay, fine. Now you get a picture. So I need a network of healthcare, starting from primary healthcare, and that also going to the community as well. So we are right now running a reform. Within Bangkok, we have 50 district, 50 district. However, we actually divide ourselves into 7 health zones. Each of the health zone would work by hospital under BMA as a zone manager. And then we have UHOSNet and the other hospital of the Ministry of Public Health as our mentor, working as a system manager. And our public health care center is actually an area manager. With all of this all together, linking with the community, we have another body, I think we all know. It's very famous during COVID in the stage of community, is our public health volunteers. Thailand public health volunteers is actually very famous during COVID. And fair to say, we survived because of them. Without them, no. Our situation would get even actually worse than what it is. So right now, under our policy, we're trying to tie all of the network. And right now, we open the sandbox within our zone 3. Basically, one of the Bangkok hospital, Charoenkung, would be linked with Chulalongkorn Hospital that belong to UHOSNet, super tertiary. Lertsin belong to Ministry of Public Health, me, BMA. And then another 17 public health care center in the community, another 30 pharmaceutical stores, and another 21 of the private clinic. We are right now linking the data of patient in one system, hoping that with the 13 digits as a national ID, you can access any history of your treatment anywhere you go. History, treatment, not paying yet. The payment we talk later, that is another complicating thing within Bangkok. Just leave it at that. But not only healthcare, I already said wellness, including environment. So we're creating an equity through the environment. So basically we have the Pride Clinic. Right now we have 31 Pride clinics around Bangkok. And very famous, one of the days, some of our center having about 100 patients coming in and out. And these are our service that we're providing in Pride Clinic. And congratulations to LGBTQIAN plus community for equal marriage kind of law that we actually just launched. So these are also, we have, when we talk wellness, it's not only physical, it's psychological too. Being able to love anyone you want is also cherishing, nourishing mind and make you actually feel comfortable. We're also accessing 15 minutes a lot of people ask, why do we have a policy of 15 minutes? That's the longest time that urban people willing to walk. Only 15 minutes. 500 to 800 meters from your house. It has to be a green area for you. And if we can do this, not only that, we're actually increasing the green area. We're trying to do carbon neutral. We're getting into net zero soon. I don't know when, but we are trying to. And also within this, you are talking about right now, Bangkok is at 7.8 square meter per person. Another 1.2 we will reach at 9.0 square meter per person, and that qualify as a healthy city of the WHO. So we're trying to get there. Right now, our 1 million tree within 4 years, we already get to 960,000 trees in 2 years. So we are looking at 2 million in 4 years. If we can do that as well, then we increase the green area. And we also actually, as I said, we are trying to do these of the digital platform so that people come and access public places. If we can provide green park, if we can provide public places for people to have activity, then at least you walk, you exercise, you're stronger. Being stronger, that's a bless for any health and wellness. And also with this, people have interaction rather than just actually talk together through this. And that would actually also somehow help supporting a psychological mind. We are planning for bike lane and walkable lane. The bike lane, it will actually end up 500 kilometers connectedness with no stop. And another 1,000 kilometers for walking within Bangkok. We will aim into that, an open library for people to come out and making formal education turn to social learning. With the social learning, once the society get more developed, then a literacy of technology is one of the things that we are actually concerned of. And of course, universal design, everyone knows that. And this will also help us to support disabilities. Right now, we're actually supporting disabilities and bedridden kind of patient in terms of spatial data. We are trying to have them being able to help themselves, serving dignity of each of the person and also be employed. Right now, Bangkok is employing 606 employees as volunteers and another 9 people as a civil service. I think we are the first public sector that actually hire disability as of a civil service system. And also encouraging private partnership into us so that we can work together through those health fund. Right now, a lot of foundations and a lot of elders club. What else? Youth clubs is actually joining us to spending a health prevention and promotion kind of projects so that people are actually much stronger. We want them to not be in bedridden or house ridden. We want them to actually addicted to society and then having friends in person, not through this monitor. Last but not the least, we also launched one of the new projects. It's actually not new. It's almost half a year already. Right now, we are doing health screening. Health check, 1 million health check for free. When I said for free, Bangkok subsidized another +3 in which if you go to the health checkup in private hospital or even if you go by your sponsorship in your right of UC or Social Security, you would not get examined CBC, glucose, triglyceride, and all the liver disease and else. We do that for you. We do EKG, we do chest X-ray, and we do those of the DM, and also eye pressure for those diabetes. And the reason that we do all this is not just because we want everyone to access to the health promotion, but I believe, if I'm right, I'm trying to be humble here, but not. I think the data that appeared to you right now is the best data of health care that Thailand has right now. If you access the system right now, type health.bangkok.go.th, you can get into this database. We are at the Open Bangkok. Any data that belongs to public, we return it to public. And this would help me as a deputy governor to actually make a public health care project. Because this data is desegregated into sub-district and also desegregate into if you work at a people on construction site, if you actually, your house is actually at a high-rise building or you are in a very density kind of community, then the condition of health of all of the community desegregated into type so that we can launch healthcare promotion that is actually according to the health status. And that would help in terms of strengthening health so that people get stronger. And then when they get sick, we have the doctor as close as they can, or telemedicine, teleconsult with the data that get through. We increase more of the emergency services like motherlands because ambulance cannot get to anywhere in Bangkok in 8 minutes. Motherlands can. Motherlands is actually average time. It's actually 7 minutes. And you cannot bring the van to carry people, so you carry paramedic to them first, and then the van follow. So you have 2 times or 3 times of the 8 minutes. That's how we actually deploy. Hopefully, all this together with a network of care, we can actually do both wellness and then healthcare at time that they want to actually be in our treatment. So, and it's still challenge present. And this, it's Twin Novajan Chanchai that you pronounce the name. He is my governor. And the challenge is also present. And we hope that one day with this the network and with this of the work that we're trying to do in terms of analytic data of health, we can actually arrive at more of the healthcare and wellness to people of Bangkok. Thank you.
Thank you so much for enlightening us about your wonderful work. And now we'll pass it off to Dr. Rao.
Yeah, thank you. So, two earlier speakers mentioned their model in Singapore and Bangkok. So I'm going to touch on the challenges and also the barrier related to the public policy. But before that, good evening to everyone. I'm indeed honored to be with all of you today in the International Convention on Nation Building, Wellness and Peace. Indeed, today I'm particularly excited to talk about the improving healthcare system and healthcare policy for wellness, creating environment for equity. Healthcare is a fundamental human right, yet it is remain rich for many people. The disparities in the healthcare access and outcome are glaring and reflecting the broader inequities within our societies. It is crucial that we, as the leaders, as the policymakers, healthcare professionals, need to strive to create a better environment for an efficient, effective, and importantly, more equitable environment. So first, we look at what are the current status of our healthcare system. First, we have unequal access. Many individuals are facing a barrier to the healthcare. This is simply because of the differences in their income among the country, the location, the geographical factors, and also the insurance status. Different countries have a different financing paying mechanism. Second, the disparity in the outcomes. We can see that those who are marginalized communities, the population, have a lesser health status, health outcome compared to those who are general population. And we can take example even in the Asian healthcare for a glance. We can see that Singapore have 23 doctors per 1,000 population, and compared to the Indonesia, not even 1 for 1,000 population. So these are the disparity in the outcome that we can see at a glance. And third will be the unsustainable costs. We need to agree that the cost of the healthcare is rising every year, and it is unsustainable cost that these costs need to be tackled by the government and to afford as necessary for them as well. So what are the barriers for the equitable environment? I like to classify all the barriers and the challenges into the 5 main groups. First will be the financial barrier. The financial barrier here is related to the cost of health technology and accessibility issue. High cost of healthcare services and lack of the universal coverage prevent most of the people or the community to take necessary treatment. For example, some of the population are still lacking in financial to do a basic preventive screening. So I'll be glad that if the government consider to provide a free screening, but need to be reminded that many people are still lacking in affording a basic preventive screening. Second, geographical barriers. Many of the countries in the world are divided between the urban and the rural because of the geographical factor, and this divided people from the urban and the rural area. So some of the places, the people there cannot afford or go to get their basic health care. For example, certain places in Indonesia or even in Timor-Leste, people can afford to go if delivered simple, safe birth delivery or even to get the basic immunization just because from their home and to their health place, the clinic, the distance are few hours away, and even the road transport system is poor. And thirdly is the infrastructure challenges. Although we are talking about the digital area, teleconsultation, and so on now, many of the health facility are lacking in the basic facility as well. They even don't have laboratory investigation or simple chest X-ray investigation to assess the patient basic needs. That's the third one. And fourth one is related to the socio-economical and cultural factors. So these factors are varieties. These are including the cultural belief. We have some population in Indonesia that if for them to get the basic to go and delivery, they still need to get the permission from their spouse or husband, and this preventing them to getting a basic healthcare services. Other than that, we have some population that they are having a language barrier, social stigma, and also they can't engage with the doctors because of the belief by the community itself. And this not to mention that other stigma related to the education, awareness, and also gender disparity. And the fifth one that I like to highlight is that policy and the governance in the public administration itself. So some of the policy in the countries are very good, very maintained, but however, some of the policy need to be revised to tackle in the current health status. And this includes whatever the trade agreement between the countries, inter-countries or intercontinent, and also other related, for example, cooperation within the country. So as mentioned by His Excellency just now, Ambassador, that during the COVID, I think we have learned a lot of things. So all the policies and governance, especially the transborder health, public health emergency, need to be reviewed either. Next, I would like to suggest what are the way to overcome or promote this environmental equity issue. First, we need to promote preventive care and wellness initiative. First, this will be a preventive screening. So prevention is better than cure. So the basic prevention, which is the diabetic, hypertension, or body mass index, and so on, need to be done earlier at the preventive screening before it become a chronic. We at the Asian countries especially are among the champions in the obesity disease and also chronic diseases. So we need to encourage with the preventive screening. So we do welcome any preventive screening policy or system that we propose. This will reduce the burden on the healthcare system in future. Second, the education and the awareness. We need to come with the health education system or health education material that can educate the people on healthy behavior or healthy eating and so on, so that we can create the inspiration to live healthily at the young age. We need to incorporate this education and the awareness at the school level itself. Third is a community-based program. I believe that Thailand have many community-based programs involving the volunteers as well. So such community-based program, even wellness initiatives, should be engaged with all the local communities, both government and also private entity, so that we can empower the individual to take up an active role of their health. So here we can address the issue of the financial issue that we don't no longer dependent on the healthcare professional only. We can dependent on the community trained healthcare as well to do our community-based program. And third, we always need to remember that holistic approach is one of the important initiatives in the preventive care. So addressing physical, mental, and social determinant of the health is one of the component in our well-being. Next will be the improving the healthcare policies. So I believe that many different countries have different health policy. So it need to be accommodated according to their current legislative and governance of the particular country. So first is the insurance coverage. Some of the countries have their own insurance mechanism. So policy related to the insurance need to be reviewed to assess so that many people are affordable, and the health insurance also should be comprehensive and address the issue of the financial barrier. Secondly, we need to invest on the infrastructure itself. It can be a clinic, hospital, or also telehealth services, and also improve the access to the underserved area. So underserved area, some of the population here still have lacking in the connectivity. So if we looking into digital health and also teleconsultation, we need to start into investing in this kind of infrastructure. And third is the competent care. We need to start train our healthcare providers to be culturally aware as well, because we are as an Asian country, we are rich in traditional and belief. We need to train them culturally so that they can be aware and linguistically responsive to improve the patient experience. In addition, patient care policies, drug policy, health safety policy, and also safe staffing policy need to be taken into account in our existing healthcare policies. Third, very important in our healthcare system, we only focus on the healthcare provider, but patient also we need to take into account. So we need to start empowering the patient and fostering patient-centered care. First, patient engagement. So in any treatment or in any diagnostic with the patient, we need to actively involve with the patient in himself to address and to discuss with them any health outcome and also satisfaction. Secondly is that shared decision making. Any decision making should be a two-way conversation between the healthcare provider and also the receiver, the patient, and they need to work together to identify what are the best choice of the treatment for them. Either it is a pharmacologically or non-pharmacologically. Third is an inclusive approach. We always need to accommodate the diverse patient needs and also the preference. So patient needs can be varied according to their geographical factors, social, economy, and so on. Next, as I mentioned earlier, we need to leveraging the technology for healthcare accessibility. So this include the telehealth, digital tools, data-driven insight, and also AI-powered solution. So one of the good lessons that we learned during the COVID that we can leverage technology in our healthcare. So telehealth is something, virtual consultation, remote monitoring. We have done that during the COVID. We can expand it. Then we also have come up with many digital tools, digital app to do the screening for the people and also for the public. So we can empower patients to manage their own health. We must educate them that the health of the patient is responsibility of the patient itself. And also talking about the big data and integrating all the data between the private, government, hospital, and clinic, we can integrate all the data. And fourthly is the AI-powered solution. This is important as well. So what are the rules of healthcare policy in wellness? First, preventive approach. As I mentioned earlier, we need to encourage people to do a regular checkup, irrespective of your age group, and also educational program to help the individual to maintain the good health and also detect any issue at the earliest stage. Second is accessible coverage. We need to look into affordable insurance plan to empower individual to seek the help that they needed without considering their financial barrier. Third, it must be always community-centric. Policy that we created should be invested and look into the community-based initiative. This include the wellness center, public health programs, volunteer program, and any other healthier environment. And fourthly is addressing the disparity, as I mentioned earlier, all those marginalized communities. Okay, before this will be my last slide. This is the Commission for Social Determinant of Health. So here, two main components will be addressing the social determinant of health in order to have an impact on the equity in health and also well-being. So firstly is the structural determinant, and second is the intermittent determinant. Both these determinants will help us to determine which policy or intervention that is important to intervene in the health and also the well-being. The structural determinant is the socio-economic and political context, which is our government's public policy, macroeconomic, social, health, and education. And this is interrelated with the intermediary determinants, which is include material circumstances, psychosocial, behavioral, and also biological factors. So as a conclusion, I'd like to say that to build a healthier or more equitable environment, we need to address the systemic issue, empower the patient, and create a healthcare system that prioritize wellness, foster equity, and also promote well-being of the individual. Through a collaborative effort, both the government, private, and also the public, we can build a healthier and create an environment for equity. Thank you.
Thank you so much. And next we have Dr. Juan Rudy.
Thank you. Do you think health equity is important? By the show of hand, who think health equity is important? Okay, thank you. So I hope people who didn't put your hand up are still thinking whether it's important. But I think you would agree, if you think about it, majority of people would say that it's important. So in a way, it makes you wonder, why are we still talking about it? And I think His Excellency Ambassador from Kenya mentioned a really good example that I will come back to shortly. But if we all think that it's important to begin with, it may be a lot easier to think about how can we create environment for equity. And as mentioned, my name is Juan Rudy. I'm a researcher at a research organization, part of the Ministry of Public Health in Thailand. I also teach at University of Toronto in Canada. And to spend the next 9 minutes, I would like to ask for your help so we can finish together. So can you please bring up your phone? Please don't check line or email yet, just 9 minutes. If you can take a picture of the QR code, or you can go to Google, Safari, put in the webpage, menti.com, put in the number 7478-5169-865. That's not the lottery number, by the way, although we may wish it is. Okay, yes, once you're in, if you can give me a like, that would be great. We have 4 people now. We'll wait until maybe just 10. But while we are waiting, I also would like to say thank you to Ajahn Geringsak and the organizing committee for having me here today. Okay, so 10. Okay, please continue to come in. You will continue to find the code on the top. So if you get kicked out of the program, you can always come back in with that code. All right. Now, if we were to go back to during the pandemic, which continent got COVID-19 vaccine first? Put the pin on the continent that you think. So I see North America. Yeah, somewhere maybe in Europe. Yeah, North America come up quite a bit. Definitely not Thailand. We all know. Yeah, okay. So there are more people, right? Now, if equity is really something that is we all think is important and is there, wouldn't we don't see this discrepancy? And as mentioned, the ambassador highlighted, vaccine nationalism is very real. So COVID brought many bad things, but I think it is a reminder for us to show us that health inequity is still there. Despite nature call it unprecedented achievement scientifically, our humankind done something we could not have done before. 10 billion COVID vaccination within what? A year. Manufacturing, distributing everything, but the gap in health equity is wider than ever. So when we think about equity, another important question that people often think is about high cost thing, high cost technology, high cost intervention, high cost medication. So how much do you think is the most expensive drug in the world today to treat one person, just one person? This is in Thai baht. 100,000, nobody going for that? Okay. 1 million, 10 million, okay, we got somebody with 10, 50, 1, what do you think? So a few, okay, we don't want the 100,000 to feel bad, right? Equity, so everybody should get $1. Okay, so 1 million, 10, so yeah, okay, around 1 million, 10 million. Technology in healthcare has come a long way. There are life-saving treatment now, but they're very expensive. How expensive? In 2019, the most expensive drug is set at 2.1 million US dollar is for SMA. 2022, 2 years ago, that number go up to 3.5 million. And just earlier this year, it's now set at 4.25 million US dollar, over 150 million Thai baht. But they're life-saving. So how can you justify saving one life versus use this amount to do so many things, many great things that Deputy Governor said we could do for Bangkok. But this is one life. So what are we going to do about it? Just to be clear, I don't have the answer in 5 minutes, but we could put in more money, sure, in healthcare. But as the Secretary of State in England said it, but what are the trade-offs? What do we have to give up to put more money in healthcare? Now, if we were to step back, the goal could be maybe to look at the value of health intervention. And as this picture shows, you would want different information about the value, right? So if you want to evaluate or invest in health intervention, what information would you want to know? You can click more than one, again, on your phone. Or maybe if it's not working, I can ask, like, who would want to know whether the intervention work? Yeah? A hand, just one hand. Yeah, okay, thank you. Okay, equity, you would want to know about equity. You want to know about effectiveness. You may want to know about efficiency. I'm a health economist, that's what we do, efficiency. You would want to know about patient input. You want to know about others. There's so many other things, budget impact. Those are very important as well, right? But a lot of people are saying effectiveness and efficiency. And to be clear, I did say you can click on that apply, but why is equity doesn't get as many dots as effectiveness? But why? If we all think it's important. So, but yes, we can look at more than one piece of information. When we want to look or to show the value of a health innovation or health policy or intervention, we want to look at different evidence. And wouldn't it be nice if there is a method, a tool that allow you to create this evidence package? And it's called health technology assessment. And it helps you look at 3 things. It helps you look at evidence synthesis, economic evaluation, and LC, which is ethical, legal, and social implication. So evidence synthesis, it will help you answer whether your intervention work or not. But it's not going to stop there. It's going to help you look whether is it a good value for money. Will you get your return of investment? And last but not least, it will help you look at the feasibility, including equity as well. So we are doing that in Thailand. So to go back to the moderator question, can we share some example of what we are doing? We are doing this. Any medication, if it were to be included in the national list of essential medicine or the list of essential vaccine, including the gold card, as in Thai we call it batong, but it's the universal coverage scheme. It will undergo the process to look at health technology assessment for those items. Now, equity is still very important. And in reality, we're not there yet. So to come back, my last point is, as a health economist, what are we going to do about it? Yes, we like working with numbers. And most of the time, what we will show you this plane. This is a cost effectiveness plane. It doesn't look as cool as an actual plane, but we think it can do so much more. It will tell you the cost, and it will tell you the effect of the intervention. It will tell you whether your investment would be a good value for money or not. But it doesn't take into account equity. So just in the past 5 years, we've been working with the health economist expert in England, and there's now a method called distributional cost effectiveness analysis. We're now going to shift from just looking at cost and effect to also include equity. So you will not only be able to look at the intervention that is cost effective, but you'll be able to look at the intervention that is cost effective, but also improve equity. So you want to be in the upper right. And if there's something that is cost effective, but it's hurting or widen inequity gap, then we will know about it too. As we know in the end, there are many things we can do because Dr. King summarized best. Our life began to end the day we become silent about things that matter. And I believe all of us here, as you said it, equity matter. So what are you going to do about it? Thank you.
Thank you so much for that call to action, that inspirational speech. And next I'll hand it off to our host because I think we are out of time for a Q&A, unfortunately.
Thank you all the panelists here, including Miss Andrea Chant, who is also here with us in Zoom. Okay, and thank you all the panelists and the moderators. Can we please have Professor Dr. Kriengsak Junwongsak on the stage to present a mementos of appreciation, please?